Good morning, I'm Adam Sexton. The COVID-19 pandemic remains the state's #1 health concern, but the opioid crisis that became a major public policy issue in the last decade never really went away and is rearing its ugly head once again. Here this morning from the front lines of the ongoing struggle against drugs and addiction are Chris Stawaz, Regional Director for American Medical Response, AMR, and from the Drug Enforcement Administration, John Delana, Associate Special Agent in Charge. Thank you both for joining us, gentlemen, and I want to start with you, Chris. AMR says last month's opioid overdose data from Nashua and Manchester shows, quote, an alarming trend of a resurgence in opioid availability and use. Not only that, you're seeing more people using multiple drugs at the same time. So what's going out on the streets right now, and how does it compare to where we were pre-pandemic?
Thanks for having me today, Adam. Yes, we are seeing an alarming increase. The good part of that is, if there is a good part, is that New Hampshire was one of only 2 states in the country not to see an increase in opioid-related deaths last year during the pandemic. So we clearly bucked a trend from that standpoint. That being said, our numbers for 2021 thus far are significantly higher than they were in 2020 during the middle of the pandemic. But they're still not above the 2019 level, which is encouraging. A number of different programs in place I believe are keeping it that way. So we've still got some work to do, and we certainly don't want to lose focus of the importance of the opioid epidemic or substance use disorder in general, for that matter.
John, how about on the enforcement side? How did the drug trade adapt to the pandemic?
Well, you know, these drug trafficking organizations are better at this than anybody. They see vulnerabilities and they seize upon it. They understand that throughout the entire United States, and particularly in all of our communities in New England and New Hampshire, we've been stretched thin responding to, you know, the myriad of problems presented by COVID-19. But they never stopped. They don't have to play by any rules. All they've done is double down their efforts and pushed more drugs into our communities than ever before. And we see that in terms of the CDC rates, 90,000 Americans dying of a drug overdose in a 1-year period. It's the most that's ever happened, and it's alarming.
We're so used to talking about opioids in this setting, Chris, but how much of a factor right now are methamphetamines?
Unfortunately, we're seeing a large increase in the amount of methamphetamine that we're dealing with. We're actually even seeing methamphetamine mixed with fentanyl. Which is an alarming trend, something that we've never actually run across before. And that creates a really unique public safety challenge for us as we awaken somebody with a Narcan reversal drug and find out that they are now under the influence of methamphetamine, which can make it a very dangerous situation for everybody involved.
Yeah, explain that, Chris. Usually when you do the Narcan wake up, the people aren't too happy about it, but when they're on meth, what are they acting like?
Yeah, meth makes people what we call have an excited delirium situation where they can be very, very unpredictable, very paranoid, very aggressive. So those are situations that we have to approach very carefully, and we have limited options about how we can reverse that effect that they're underneath with the effect of methamphetamine. Unlike an opioid where we can give Narcan, turn it right around, we can't do that with methamphetamine. We have to manage them in a very limited number of ways.
John, historically, you've got the home-cooked meth, and then there's the overseas stuff, which can be more potent, addictive, and destructive to the community. Where is the meth coming from right now that's arriving in New England?
Yeah, so you bring up a great point, Adam. We have had a methamphetamine issue here in New Hampshire, and it's been created in labs, usually in the northern part of the state. This is completely different. This is highly potent. It's much different. It comes in a crystallized form, and for the most part, it's from the transnational criminal organizations operating in Mexico, and it's coming up into our region. In fact, the stuff that we've been seizing, the crystal meth we've been seizing, has been testing somewhere around 99 to 100% pure. It's a complete game changer from what we were used to. And I will say that historically in New Hampshire and in all of New England, they've tried to create a market for methamphetamine in the past. It's just never really caught on. This time it has, and we see it sweeping across the state. We've seen this coming. Chris and I talk all the time about the trends that we both see. The governor himself put out a mandate at the beginning of the year that he wanted to get some education out there to all first responders, and we worked collaboratively on that to get the messaging out there.
And John, is the source of the fentanyl and the methamphetamine the same, essentially the same cartels are trying to push this here?
Yes, they are. And this was a decision that those cartels made. These transnational criminal organizations are the ones that decided it's time to get a methamphetamine market in a place like New England. So what they do is from their retail dealers, their drug distribution networks, for us, it's down in the Merrimack Valley of Massachusetts. They just start putting this stuff out in the form of samples. And they're marketing geniuses, Adam. What they tell people is when you're in the lows of an opioid use, the lows of your fentanyl use, take this methamphetamine. It'll help get you up and get you moving, get you to work a job, raise your kids, or do whatever it is you have to do. But really what they're saying is it'll bring you back to buy more drugs. And that's all they care about. And, I mentioned the 90,000 overdose deaths. No number that we will ever reach in this country will cause those transnational criminal organizations to change their business model. They're driven by greed, and all they care about is addicting more people and the next generation.
Hard to imagine a more destructive up and down cycle than meth and opioids, but such a big part of the beginning of this a few years back was the overprescription of painkillers, Chris. And I'm curious, there were a lot of policy changes made over the last few years. Do you see that working at all? Or do you see fewer people who are starting their addiction when they're talking to your guys out on the streets that started from that surgery or that injury that started with a prescription?
Yeah, I believe we have seen a big difference in that. We're seeing more and more illicit or fake pills that are being made now by the drug cartels. It's not you're going into the drug cabinet at home and getting your leftover prescription. There is still a little bit of that, but certainly not like we saw at the beginning of this situation a few years ago.
John, what's the latest innovation you're seeing from the drug traffickers? I've heard there's a very insidious way that they're trying to be able to get these pills into the hands of kids, where they're going to be able to hide them and play inside almost.
Yeah, Adam, thank you for that question, because truly in the 25 years that I've been with DEA, there's nothing that's been more disturbing to me than what I've seen recently. The traffickers have started to put fentanyl in pill form. We've seen that for a while in New Hampshire, and that was in response to, cracking down on the overprescribing practices that you specifically talked about. They wanted to make those pills available. So in the form of a Percocet, a Xanax, a hydrocodone, they put nothing but fentanyl inside it. And as if that wasn't bad enough, the trend that we've seen since March of this year, pales in comparison. It's Adderall pills, which we know are widely used and abused by young people, and they're putting nothing but crystal methamphetamine into these Adderall pills. And they're all over New Hampshire right now. And I got to tell you, it's very, very troubling to me. We've been working hard to get that message out there. It's just, if you are coming across pills right now on the street, if you're buying them from somebody that they weren't prescribed to you and they haven't been in your control, there's a very high likelihood that these are exactly the pills that we're talking about, either filled with methamphetamine or filled with fentanyl. And I have to say, this is a conscious decision on behalf of these drug trafficking organizations to target young people. They know that it's young people that use Adderall in this country. Middle school, high school, and college kids throughout the United States are using Adderall, appropriately in some cases, but some people do abuse it. And this is a conscious decision on their part to specifically go after the children of this country.
Chris, once you get people out of that emergency situation, there is, of course, the work that needs to begin to try to get them better, recovery, treatment, things like that. We've seen some organizations, nonprofits, run full face into this problem and get eaten up by it. What's your level of concern right now with the resources and funding that are going to the treatment and recovery side of things?
Well, I think appropriately so. There's been a tremendous focus on COVID. No question that that's the number one health issue in America right now and across the globe. But also, it's a dual pandemic, if you will, in some cases of substance use disorder and the COVID-related pandemic as well. So we want to make sure, keep the message out there that there's funding available for treatment and recovery, workplace-friendly areas for people to go to when they're in recovery, and most of all, housing. The substance use disorder crisis leads to all sorts of different socioeconomic difficulties, whether it's increased crime or unemployment or homelessness. Those are all things that are blended together. So it's critically important. And I think New Hampshire has done a very good job and continues to do a very good job at making recovery services available for that moment of clarity. Somebody is ready to seek that recovery moment. That's one of the beauties of why Safe Station works so well. When somebody was ready, they could walk in and get that treatment that they were looking for. The doorways of New Hampshire offer that same type of opportunity, and it's going to be very important that we continue to do that going forward.
When we talk about this issue, we often use words like fight and battle that evoke kind of a wartime imagery, but wars end, right? This is a public health and a law enforcement situation that's ongoing, and there's no real finish line, is there? So I'm curious, John, how do you maintain your strength and your focus knowing that this work, there's no victory parade at the end of it? You just have to keep doing it.
Well, I got to tell you, I'm more proud of the men and women in law enforcement and first responders, particularly in New Hampshire. I think we continue to be the gold standard. I have the opportunity to work for a worldwide agency, so I get to see what DEA officers around the country and across the world are doing. And I have to tell you, oftentimes they're looking to the work that's being done in New Hampshire, collaborative work. I think that sets the standard for everybody else. I'm proud of that work, and I'm proud of, what DEA particularly has been able to accomplish here, not just in terms of the investigations, and they've been great, but some of the work that we've done with prevention and outreach, and we've really gotten, to reinvent what DEA does in places around the country because of what we've been able to accomplish in New Hampshire, and we haven't stopped. In fact, right now, DEA has selected Manchester as one of 11 cities around the country to pilot this new program, Operation Engage. We're building off of our previous successes, and we're trying to find ways to continue to partner up with people throughout the community to get that important prevention message out there.
All right, gentlemen, John Delana and Chris Stawaz, we appreciate your efforts and everything you do out there in the community to fight this fight for us. Thank you for joining us.
Thank you.
Thank you.